A 32-year-old woman arrives at the emergency room with a paralyzed left side. She has no history of heart disease, no high blood pressure, and no traditional risk factors. Yet this is her third stroke in 2 years. Simultaneously, in another ward, surgeons prepare for an emergency colectomy. Scans of the patient's abdomen showed the classic signs of aggressive colon cancer, but when they open the cavity, the intestines are perfectly clean. Not a single tumor is found. Elsewhere, a high school girl watches her face transform in the mirror. Large, white patches are devouring the pigment in her skin. Dermatologists are stumped. Standard creams and light treatments have no effect on the spreading depigmentation. These aren't just modern outliers. Decades ago, on Chinese New Year, an 8-year-old boy lay in a hospital bed, his body hemorrhaging internally. His doctors had exhausted every known treatment and finally told his mother there was nothing left to do but wait for the end. For over a century, patients like these were trapped in a medical revolving door. They were shuffled between neurology, gastroenterology, and dermatology, receiving localized treatments for symptoms that only continued to migrate and worsen. Doctors eventually realized these cases remained incurable because they were treating the organs as the cause of the problem. By stepping back and looking at the common inflammatory markers in the blood across all these patients, a new picture emerged. The organs weren't failing, they were being targeted. The common thread is a rogue faction of the patient's own immune system. Instead of patrolling for bacteria, these white blood cells have turned their lethal weapons against the host's healthy tissue. This cellular betrayal begins with a specific genetic sequence tucked in the patient's DNA. It remains dormant for decades until an external force, like a severe virus or intense stress, encounters this code. This forces the gene into an active state, permanently altering the body's defenses. Once that switch is flipped, the immune system's targeting protocols become corrupted. The body's primary defense force begins to identify healthy cells as lethal threats, launching a full-scale inflammatory assault on whatever organ rogue cells encounter first. This makes autoimmune disease the ultimate masquerader. The specific symptoms depend entirely on where the immune system chooses to fight. In one patient, it's the brain, in another, the skin or the gut, but the underlying cellular mutiny is identical. Most of us are raised to believe that a stronger immune system is the absolute goal of health. We are told to keep our defenses high to ward off every passing cold. When patients feel the fatigue and unexplainable pain of an autoimmune flare-up, they often reach for potent health supplements like ginseng or lingzhi mushrooms to recharge their failing health. But when your immune cells are already misidentifying your organs as enemies, fueling them with boosters is the biological equivalent of throwing a bucket of gasoline straight onto an already raging house fire. These patients don't have a weak immune system. They have a hyperactive, misdirected one. Their defenses against external viruses are often completely functional, while their internal regulation has spiraled out of control. Managing an autoimmune condition requires calming the system, not amplifying it. This makes generalized advice to boost immunity dangerous for this specific population. Historically, the only way to stop this internal attack was with high-dose steroids. Steroids saved the life of that 8-year-old boy by forcefully shutting down the entire immune system. But this blunt approach caused massive side effects that often lasted a lifetime. Modern medicine has moved toward targeted precision therapy, using a class of drugs known as biologics. Instead of suppressing every defense cell in the body, biologics act like sniper rifles. They are designed to intercept only the specific rogue signaling proteins that drive the attack, leaving the surrounding network alone and the patient's general immunity intact. This precision allows once baffling cases to stabilize. Depigmentation in vitiligo can be halted. Intestinal inflammation can be cleared without surgery. And patients with lupus, once told they had 5 years to live, can now plan for long, healthy futures. We now understand that multi-organ medical mysteries are often the result of identifiable signaling failures. If you are facing a condition that specialists cannot explain, prioritize the system over the symptom. Consulting an immunologist allows you to identify the specific protein markers causing the conflict and begin negotiating a targeted peace within your own body.